It's still a work in progress. Hang on. There we go.
Hi everyone, this is Dr. Reuben, Sim here from Dental Boutique. If you find that this video is going to be helpful to you, what I'd like to do is that if you could kindly subscribe to our link below or forward it to your friends and family. Now the topic we will be discussing today is the difference between braces and Invisalign, or any clear aligner for that matter. So let's talk about braces first, and then we'll go on to Invisalign after this. Braces has been around for many years, and they come in the form of metal brackets or in ceramic brackets, and there's a difference between the two as well. Now braces as a whole would mean that you've got little brackets or buttons in the teeth with a visible wire across your teeth on top and lower. It's a fixed appliance, meaning that they're stuck on your teeth and you're fixed. What this means to you as a patient is there's less compliance needed on your part, meaning that you don't have to do much to actually put them on because they're on already. The only time there's any compliance needed on your part is when you need to put some rubber bands or elastics on your brackets so that we can move your teeth or jaw efficiently, and that's a case by case basis. Number two, it helps to move certain teeth movement more effectively. One of the key factors with braces is that it's very helpful in moving impacted teeth, or and most often canines in this case here, where if the teeth are stuck up in a palate or right up to the back, we can actually pull it down a lot more effectively compared to any clear aligners or Invisalign. It's just the mechanics of it. So if you've got any impacted teeth per se and you want to bring them up, that will be a really good way or method to do it. The third one would be in terms of uprighting teeth, braces sometimes would be a more efficient way to upright some teeth as well, but again, it's a case by case basis. On the flip side of it, with braces, food wise, you need to be more comfortable that food may get stuck in between your teeth when you're out, when you're eating, which means that you will need to rinse your mouth more often after meals. And number two, you need to brush them a lot better. Now, when foods get stuck in between the brackets and you leave them on or they're not brushed out, what will happen is that over time, bacteria will start to latch onto this food and produce acid, which will then in turn start to reduce the amount of minerals around the tooth, which will then create an aesthetic defect where you may get white patches on your teeth. Now, you will find that sometimes a lot of in some adults or some teenage boys and girls where the braces are off, you see white patches on their teeth. That's probably due to the fact that brushing wasn't as adequate as they should be, meaning that they leave the white patches. Now, the unfortunate thing about the white patches is that they will rarely go away. Over time and over years, they may reduce slightly over time, but I would say that's more. The reduction will be quite minimal and to a certain extent only. It's like scarring of your teeth. It's like if you've ever fall and you get a cut in your skin, in your knee, and scrape your knee or elbow, sometimes you get some scarring around the skin as they heal up. Same thing with the tooth. Sometimes if there's a lot of acid buildup around the area that wasn't cleaned off due to not being able to brush the area as well, you'll find that the tooth will scar, and the scar comes in the form of white patches in the teeth. With the other point about braces is that because it's fixed, there's a less compliance on your behalf, meaning that they will definitely work. There's no such thing as whether it will work or maybe it will or maybe it won't. They will move your teeth as long as the dentist place them where they're meant to be, because the thing is that braces in general would have the wire that automatically moves the teeth to the right position without any effort on your part. Now, the other point about braces as well is that because it's made of wires, because there's a lot of wires around the area and some brackets on the teeth, you may experience more discomfort potentially compared to any clear aligners out there. A lot of my patients would do them, when they do them, they will come back with some ulcers in the teeth, and the discomfort is slightly more marked compared to clear aligners. So the reason why some patients would prefer to do braces is due to the fact there's less compliance needed on their part, or when clear aligners like Invisalign cannot be used to move certain teeth. The downside with braces is that hygiene needs to be impeccable, meaning you need to clean your teeth really well, and you may need to put up with a bit more discomfort over the period of time. And number three would be the aesthetic profile. So if you're not concerned, or if you're concerned about your aesthetics when you're smiling, braces could or could not be for you. So if you are always in the social media, or if you're a newscaster, and depending on your job and your occupation, and you don't want to have visible braces, then it may not be for you. Now, remember I mentioned to you before, as you start, we've got metal braces versus ceramic braces. So the difference between metal and ceramic braces is only got to do with the color or the material that we use for the brackets. The ceramic brackets are generally more fragile, meaning that it's a bit more brittle, and over time there's a bit more replacement issues as you go along. And number two, sometimes they may be less effective due to the fact that when they break, you need to wait for a while to get a appointment to come in, so that this may actually prolong your appointment time slightly. Now, the other thing with brackets, ceramic brackets, is that while they might look really nice and white initially, over time they'll end up staining and they end up looking more yellow or brown, which sometimes gives not a very aesthetic look, because it's either because it's not white and it looks a bit yellow, it tends to have that connotation that it's a bit dirty. Whether you do braces with a metal or ceramics, end result should be quite similar. With ceramic brackets, you've got a bit more maintenance that needs to be done, where they might break a bit easier. And number two, you need to brush them even better, because you don't want them to stain over time. Metal brackets will not change in color at all. So they'll stay metal and they'll look the same from start to finish. So hopefully that will give you a bit of understanding, has given you a bit of understanding with what metal and ceramic brackets are, and braces as a whole, as a treatment type. So what I'm going to do is I'm going to talk about the clear aligners now. Now, clear aligners come in the form of Invisalign, and there's a few other brands out there that's also doing clear aligners. Now, I'll be using Invisalign as a clear aligners because this is what we normally and generally use in our practice. Because after using many aligners, we find that Invisalign has produced and given us a more predictable result over time. I'm not saying that any other clear aligners are not good. It's just what we find that with Invisalign, it works well in our hands. We've done close to maybe 1,000 Invisalign cases over the past few years, and we know that it works really, really well. So the disadvantage with Invisalign is that you will need to be compliant with the treatment, because if you do not put Invisalign in your mouth, it will not work, right? So typically it should be worn at least about 20 to 22 hours a day. That 20 to 22 hours a day is really important, because the more contact time the aligners have in your mouth, the quicker your teeth move. So for sure, you can wear them for less hours in a day, but that would mean that you'll prolong your time for the Invisalign treatment. So there's always a give and take in the clear aligners. So compliance is key. Number two, certain teeth movement will be very difficult. For example, pulling teeth down from the top of the palate. That sometimes can be quite difficult, and I would say with Invisalign, it's actually very, very good in some movements like correcting of an open bite or deep bite. We find that it works really, really well. So now, moving on to the advantage of Invisalign is that it's clear, meaning that when you smile in photos and camera and everything, you can have the Invisalign in your mouth without anyone knowing you're wearing any orthodontic aligners. So they're actually quite nice and clear. Number two, food-wise, you can actually eat anything on, because when you're eating, you'll be taking out the aligners to eat and chew. So what this means to you is that your teeth will be easily cleaned and rinsed out, and brushing will be very simple as well, meaning that there's actually a lot less risk of bacteria and acidic formation on the surfaces of your teeth, as long as you brush them twice a day and 3 times a day and following the normal hygiene protocol. Number three, with Invisalign, is that because it's removable, you can remove them during important functions like a wedding or prom or any events that require a lot of taking in and out. You can actually have them removed for a few hours and put them back on later. The other aspect about Invisalign and why young adults or teenagers like Invisalign a lot is because of the comfort as well. So because it's a very clear, soft plastic aligner, there is no wires stuck around the area, there's no brackets around the area, meaning that development of ulcers is less prevalent. When you first start doing Invisalign or any orthodontic treatment, whether it's braces or Invisalign, you will get some form of discomfort for the first few days. We find that with our patients, after doing braces and orthodontic treatment with Invisalign, we find that patients with Invisalign tend to have a lot less discomfort, and most of the time the discomfort will last maybe a day or two, sometimes maybe up to 3 to 4 days, and is mainly tightness around the teeth. A lot of times patients then ask us, how would I know which treatment is better for me? Would it be braces or would it be clear aligners like Invisalign? Now, the answer to that question really depends on your lifestyle. the result and the outcome you get would be similar. Meaning that if it's the right treatment modality applied to the right patient, and the patient understands their compliance or hygiene methods, you get a very similar result for both the options. There's no right or wrong in a lot of the situations. The only time where you use braces and not Invisalign is that when we have to pull teeth down from the top of the gums or the palate. But otherwise, in most cases, Invisalign or braces will generate a very similar outcome, as long as you understand your obligations for each treatment. For example, braces, you need to be brushing them really well, you need to clean your teeth really well in between and flossing out a lot more. That will be more of an obligation on your part, but you don't have to wear them, and remember to put it in and out because it's fixed in there. While Invisalign, the obligation on your part, on your onus is on you to ensure the treatment works by putting them in. But at the same time, you get a benefit of maintaining a normal hygiene where you can just brush them normally, floss them normally, and eat normal foods, and have the advantage of having a very clear smile during the process of 1 to 2 years of getting your smile corrected. So again, there's no right or wrong in any of the situation. Make sure you discuss with your dentist or your orthodontist about what your needs are in your lifestyle, because a lot of this is also very lifestyle connected, where if you can't be compliant, braces is probably the way to go. If you can be compliant and brushing wise is something that you don't mind, then probably Invisalign is the way to go. The other question that we get a lot, what is the cost difference between braces or clear aligners like Invisalign? In most cases, the difference between braces and Invisalign isn't much. You're looking at maybe up to $1,000 difference. The reason why there's that difference is due to the fact that the material or the product that needs to be used is slightly of a higher cost. When it comes to the time taken to do those treatment, whether it takes more effort, it's all the same on the clinician's point of view or the patient's point of view as well. So the main difference is basically the material that's been used. Braces are slightly cheaper to purchase overall, while clear aligners in general are slightly more expensive to purchase to be used. So that's the difference there, but the difference in general would be maybe about $1,000 difference, not more than that in most cases. So remember to always check in with the dentist and advise them what your lifestyle is and what do you think would make sense to you. And from then on, as a dentist, then we will be able to again go through with you the pros and cons again based on your unique individual circumstance. Hopefully you got a bit more information about what we do and what the differences are between braces and clear aligners. If you've got any friends and family who you think who's deciding between the two and they're not certain what to do, send them this video, because I'm certain that this may help them in deciding what needs to be done and at least give them some questions to ask their orthodontist or dentist when they see them. That being said, if you find that this is helpful and you'd like to receive more information in the future about other topics, maybe click on the comments below, write some topics out there so that at least then we can read them through and we can maybe put up some of the topics down the future. Remember to subscribe to us if you haven't done so, and we'll see you very soon in the near future. Thanks for listening. Bye.